Hi everyone. Today we are going to discuss about dialyzer reprocessing. First of all, dialyzer reuse. Dialyzer reuse is a process of used dialyzer cartridge with or without the connecting tube for repeated hemodialysis in the same patient. First described in 1964 by Sheldon with the refrigerator coil dialyzers containing the patient's heparinized blood until the next dialysis. It is largely limited to hollow fiber capillary dialyzers, and its automated reprocessing machines were introduced in 1918 or 1981 and contributed to the increasing trend to reuse dialyzers. Next, there are three phases of reprocessing. First one, pre-first use. Then the dialysis treatment. Third one, post dialysis. First we are discussing about pre-first use. The pre-first use to assign the patients with proper labeling. The dialyzer is reprocessed to measure the baseline TCV. TCV means total cell volume. During the reprocessing, the dialysis is rinsed, the pressure tested and filled with germicide. The dialysis treatment, inspection of dialyzer not discolored and leakaging. It's discolored and it's seen as leaking. Then examines for the germicide, assure that sufficient volume of disinfectant fluids was present in the dialyzer to assure direct contact. Next, dialyzer treatment. First, the priming dialyzer with a normal saline and starts recirculating rinse with the minimal ultrafiltration. QB is 200 ml per minute, QD 500 ml per minute, and it's 50 to 30 minutes. Then avoid the introducing air into the arterial circuit during the rinsing process. It's trapped air in the fibers or dialysate compartment may reduce the effectiveness of germicide removal. Next, rotate the dialyzers and interval during the flushing to release trapped air in the dialysate compartment. After the rinse, assure that the dialyzer extracorporeal circuit and saline bag are free of residual germicide by using of test strips of appropriate sensitivity. Rebound of germicide. If the start of treatment is delayed or someone is caused by either the dialysate or saline flow being interrupted while the dialyzer is in standby. Next, post dialysis. Post dialysis, at the end of treatment, the blood in the dialyzers is returned to the patient is flowed by first one, rinsing and reverse the ultrafiltration. Next, second one is cleaning. Then the dialyzer performance, to check the dialyzer performance. Last step is disinfection. These are the important reprocessing steps of dialyzer. First, rinsing and reverse the ultrafiltration. Rinsing and reverse ultrafiltration process when the dialyzer was still on the dialysis machine. It is common practice to put the dialyzer on manifold the flushes. AAMI stands water through the blood and dialysate compartment for 20 to 30 minutes. A positive pressure gradient from the dialysate to the blood compartment is maintained to help flush clots and plasma from the blood circuit. Next, cleaning step. Cleaning, there are two steps are. First one, initially rinsing of the dialyzer and cleaning the headers with the RO water. Then to put the dialyzer on a machine or through a manual process, that further rinses and clean the fiber using one of a number of chemical cleaning agent. Next, during these cleaning steps, staff is inspect and clean the headers to remove lipids and clots from the dialyzer. Next, the header caps are removable and that associated its O-ring can be removed and allowing a direct rinses of exposed of the fiber bundle and potting compound. Header caps and their O-rings must be exposed to X disinfectant, it means bleach or peracetic acid, before being replaced on the dialyzer. If the produce that uses assist the device, and it must specify that these devices be used only one dialyzer before they are cleaned and soaked in appropriate germicide. Next, to test the dialyzer efficiency. First, pressure test for any leaks of the dialyzer. A blood path is integrity. The test works that by generating a pressure gradient across the membrane and observing for a pressure fall in either the blood or dialysate compartment. Next, to check the pressure gradient, instilling the pressurized air or nitrogen into the blood side of the dialyzer by producing a vacuum in the dialysate side. Next, only minimal amount of air should be observed to leak through a inactivated membrane. The final part of the blood compartment, it's TCV, it means total cell volume. It is indirectly measure the changes in membrane clearances for small molecules, urea, such as. Every dialyzer distinct for reprocessing should be processed before initial use in order to measure baseline total cell volume for that particular dialyzer. It should be manufactured be labeled. The changes in TCV from the baseline is then tracked by remeasuring. TCV after each reuse, a reduction is TCV of 20% corresponds to 10% reduction in clearance. The maximum decrease is acceptable for continuous to use. Blood compartment volume is measured by the filled with the blood compartment. Then header volume and fiber volume are included with the air and measuring volume of 6 obtained fluid. The reasons for failure to reach the target reuse, total cell volume test failure suggests the excessive clot formation during dialysis and should prompt a receipt of the heparin prescription. Next, examination of after reprocessing the dialyzer. It should be peracetic acid, has no vapor. Pressure depends on the direct contact to be effective. Then less than hold dialyzer horizontally, both the headers should be at least 2/3 full. The presence of germicide is confirmed by test strips of appropriate sensitivity. Then test of dialyzer efficiency. First one is water permeability. The dialyzer ultrafiltration coefficient. It's an indirect measures membrane mass transfer properties for larger molecular weight substance. And it is measured, the water permeability is measured by determining the volume of water passing through the membrane at a given pressure and temperature. It decreases in KUF. It means ultrafiltration rate Thank you.